The RSV and the flu numbers are up. It's been a bad flu season. Did you know that these RSV in particular needs to be reported? Kyle Hoth is the president of the AMA here in WA. G'day, Kyle. Good to talk to you.
G'day, nice to talk to you too.
Bad flu season. How does the reporting process work? Is it up to me if I've got a bad cough to go to a doctor and get it reported? Does my doctor do it or do I do it?
Oh, it's a little bit of a mix. It'll be automatically reported if there's any testing done. So if you've done testing, been swabbed at all, you don't need to report it. That gets reported. But they do a bit of sampling of water and sewage and other things, looking for shedding of the viruses to help track how it might be concentrated in different parts.
Yeah. Okay. Yeah, that's interesting, isn't it? So but to identify individual cases, Kyle, we'll need my doctor or myself to report. I mean, I've had a bad chest cough, and to be honest, I went online and sought advice online. So those cases aren't necessarily reported from online, are they?
Yeah, that's right. Those cases wouldn't be reported on. So the numbers never represent the actual number of cases, and so there'll always be a bit of a variation. But they do take some of those things into consideration when we look at the overall planning. But, the raw numbers are the reported cases.
You've got a theory, Kyle, be it scientific or anecdotal, as to why it's been such a bad flu season?
Well, look, I think there's probably a bunch of things that have contributed. There's definitely been a bit of an immunity gap that's particularly with the flu, and I think that's a bit of a rebound from our vaccine fatigue and mask wearing fatigue after COVID, which definitely has seen a bit of a shift in the way people kind of act around having the cold or the flu, and probably has increased spread a bit. But we have seen kind of across the world, particularly with RSV, that there's been these sort of seasonal shifts where it seems to be lasting a bit longer, which will generally lead to sort of bigger caseloads. We also are getting better at detecting it, particularly something like RSV, which historically before COVID we wouldn't have been tracking as rigorously as we do now. Yeah.
It's very much in the minority, people wearing masks. Every now and then you'll see someone driving along in a car or someone at the shops wearing a mask, Kyle. So it's quite confronting to see it now, isn't it?
Yeah, which, I guess there was a part of me that thought we might normalise it like some of our Southeast Asian neighbours, but it really has been kind of the opposite. I think post-COVID, everybody was pretty quick to throw the masks out. And they are one way of preventing spread of viruses, not the only way. Staying at home, good hand hygiene, staying away from vulnerable populations when you're sick. There are other things we can do to prevent the spread without having to wear a mask, but a mask does make a difference for those that don't feel like they would be the pariah if they went out in public with a mask on.
Is this the new world order, Kyle? We'll see bad flu seasons ongoing from here, do you think?
I don't think they'll ever be. I think they'll always be a little bit worse than what they were before COVID, yeah. Who knows what comes next in terms of our ability to manage and treat them, but I can't imagine we'll go back to the way things were before.
I reckon Kyle, you might be mid-sentence there, but 11,500 reported cases, that feels low to me. I mean, we've got about 30 cases in here at work, I would have thought. I don't know if that's a low figure.
Yeah, look, again, I think the fact that not everybody gets tested, right? I think I got tested earlier this winter and had influenza, but I've had a cold bug since then, and who knows what it was, because I didn't go get tested on that occasion. We do deal with them sort of mild to moderate cold and flu symptoms without always going to get tested, because we know there's not much that can be done. It's rest, it's water, it's Panadol if we've got a headache, and then, don't go to work. So, yeah, you're right. The number doesn't represent everybody that would have had the virus, because we don't test for common cold or RSV or flu on that kind of level.
Yeah, sure. Kyle Hoth's with us. He's the president of the AMA. One more, if I may, Kyle. Question without notice. Yesterday on the program, we spoke about the new gun laws in Western Australia, and we talked about the need to get a medical check to renew your gun licence. What are you hearing from your rank and file about doctors being willing to be part of this testing procedure? There was concern that some GPs wouldn't sign up to the program. What are you hearing?
Yeah, I think that is our concern. I mean, to say that somebody is medically fit at a point in time to have a gun licence, our concern is what happens in 10, 15, 20 years' time because it's impossible to look into the future, right? We can really only make that judgment based on what is in front of us when we assess a patient. So it's a big ask to have that as a hurdle, and it's, I think, an even bigger ask to put that on a GP. My mind kind of goes out to GPs in the country where there's no other alternative for farmers or other people to turn to get this signed off, and if the GP doesn't want to participate, that puts them in a very awkward position. So, yeah, look, I don't think it's the best thought through process.
Yeah, all right, very interesting. Kyle, thank you very much for your time. Appreciate the chat.
No worries. Take care.
Kyle Hoth, President of the AMA